treated with indomethacin for patent ductus arteriosus. And I'm going to ask the question here. Is it appropriate, is it most appropriate to, number one, stop all enteral feedings? Would any of you stop all enteral feeding? Continue enteral feedings. Okay. Provide only hydrolyzed formula. Obtain an abdominal radiograph as a baseline in case you want to rule out that. No, doesn't make sense. So 2 is probably the correct answer. But 10 years ago, when we were using a lot of indomethacin,
this was
common practice to stop feedings on babies who were getting indomethacin. Well, here's the interesting finding. This is a study done in animals and piglets, also done at Baylor University. And they look at superior mesenteric artery blood flow during enteral feeding and during TPN. So at the left part of this, you see this high level of superior mesenteric artery blood flow. That's during enteral feeding. You stop the enteral feeding, and what happens? Superior mesenteric artery blood flow decreases. So, what was the rationale for stopping enteral feedings with indomethacin? The concern was that you would decrease superior mesenteric artery blood flow to the gastrointestinal tract with indomethacin. But if you take this and think about this, if you decrease superior mesenteric artery blood flow with indomethacin and you stop the feedings, you will decrease the superior mesenteric artery blood flow even more and make it worse. And this is actually a clinical study that was done at the University of California, San Francisco by Dr. Ron Kleiman and colleagues. And the title of this was Enteral Feeding During Indomethacin and Ibuprofen Treatment with Patent Ductus Arteriosus. And the main results were that infants randomized to feeding arm required fewer days to reach the study's feeding volume end, 120 milliliters per kilo per day, and that would make a lot of sense because you aren't feeding these babies. But there were also no differences between the two groups in the incidence of infection, necrotizing enterocolitis, spontaneous intestinal perforation, or other neonatal morbidities. So with this, I think it makes sense not to withhold feedings during indomethacin treatment. And I think we can extrapolate this to some other drugs as well. For example, some of the vasoactive agents that we use, epinephrine, norepinephrine. Here's another